This is a presentation for People's Community Health Center's lesson on vital signs. In this presentation, we will be informing you about what vital signs are and how to take them. Vital signs are outside measurements of the body that help determine what is going on inside of the body. Some vital signs are pulse rate, respiration rate, and blood pressure. In this presentation, we'll focus on these three. Let's look at pulse rate first. When the heart pumps blood through blood vessels, it passes through the arteries in waves. The surges of blood through the arteries can be felt as pulses. The number of pulses felt in a minute is equal to the number of heartbeats per minute. This is the pulse rate. Another component to pay attention to is the quality. Pulses can either be strong or weak. There are three locations to take a pulse rate. The first location is on the wrist, which is called the radial pulse. The second location is the neck, which is called the carotid pulse. And the third location is the inner elbow, which is called the brachial pulse. At Peoples, we focus on the radial pulse for taking pulse rate. We'll get back to the brachial pulse later when we learn about blood pressure. To take a patient's pulse, place 2 fingers on the thumb side of a patient's inner wrist. Everyone has their own technique, but usually pulse rates are taken for 30 seconds and then multiplied by 2 in order to determine the rate per minute. Listed here are the average beats per minute for each age range. Note that for patients over 14 years of age, the average pulse rate is 60 to 100 beats per minute. This means that if a pulse is taken for 30 seconds, the average rate should be 30 to 50 beats per 30 seconds. Now, let's look at the second vital sign, respiration rate. Respiration is the act of breathing, and it is measured in breaths per minute. Breathing in is called inspiration, and breathing out is called exhalation. 1 breath is equal to 1 inspiration and 1 exhalation. Again, we can look at the average ranges. Note that the average respiration rate for a patient older than 14 years of age is approximately 12 to 20 breaths per minute. Pulse and respiration rates are often taken at the same time. While it is okay for a patient to understand you are taking their pulse, please don't tell them you will be also taking their respiration rate. They may become self-conscious about their breathing and make this rate inaccurate. There are many techniques to take these 2 rates at once, but 2 will be mentioned here. One method is to tell a patient you're going to take their pulse rate for 30 seconds. Use this time to take the pulse rate for the first 15 seconds and respiration rate for the second 15 seconds. Then, multiply each number by 4 to get the pulse and respiration rate per minute. Another method is to again tell a patient you're going to take their pulse rate for 30 seconds. Use this time to take the pulse rate and respiration simultaneously and multiply both numbers by 2. This second technique requires a little bit of practice. Because these measurements are timed, please be sure you have a wristwatch or stopwatch on your phone. A helpful chart is shown on the slide. It shows the original 15-second rate in the top row and the final pulse rate per minute in the bottom row. For example, if a patient had a 15-second pulse rate of 20 beats per minute, their pulse rate is 80 beats per minute. Now, let's look at the final vital sign, blood pressure. Blood pressure is the force of blood against the walls of the blood vessels. This vital sign is measured by two numbers called systolic and diastolic. Systolic is when the heart contracts and forces blood into the arteries. Diastolic is the remaining pressure in the arteries when the heart relaxes. Blood pressure is presented in the form of systolic over diastolic. The average blood pressure for a healthy adult is 120 over 80. Note that the average range of the systolic pressure is 90 to 140, and the average range of the diastolic pressure is 60 to 90. The ranges above indicate hypertension or high blood pressure, and the ranges below indicate hypotension or low blood pressure. The first step in taking a patient's blood pressure is to properly position a stethoscope so that you can hear a patient's brachial pulse. Position the stethoscope with the earpieces facing forward. After placing the stethoscope properly in your ears, position the blood pressure cuff with the arrow on the cuff over the brachial artery. Then place the head of the stethoscope on the brachial artery below the blood pressure cuff. Turn the valve completely clockwise to pump up the cuff to approximately 200. Slowly release pressure by turning the valve counterclockwise. The number on the sphygmomanometer when the first sound is heard is the systolic pressure, and the number when the last sound is heard is called the diastolic pressure. In this presentation, we learn what vitals are, outside the body measurements used to help a provider determine the health of their patient. 3 vital signs of importance are pulse rate, respiration rate, and blood pressure. Pulse rate is the number of heartbeats per minute measured by blood pumping through the arteries. Respiration rate is the number of breaths per minute where one breath is equal to 1 inspiration and 1 expiration. Blood pressure is the force of blood against the walls of the arteries and is measured by the pressure when the heart contracts and expands. Hopefully this video was informative and will help you as you learn to become a confident student medical assistant at People's Community Health Center.